Have you ever stood up after sitting for a while and felt that sharp pinch? Or maybe a dull ache that just won't go away? Knee pain is one of the most common physical complaints, and it doesn't just happen to athletes or the elderly. It can happen to anyone, and the why usually falls into one of three buckets: mechanical issues, lifestyle factors, or underlying biological changes. First, let's talk about the mechanics. Your knee is essentially a hinge, but a very complex one. If your hips are weak or your ankles are stiff, your knee has to pick up the slack. Think of it like a middle manager in a company. When the departments above and below aren't doing their jobs, the middle manager gets burned out. This often leads to something called patellofemoral pain syndrome, or runner's knee. It's not necessarily an injury. It's just the kneecap not tracking smoothly in its groove because the muscles around it are out of balance. Then there are the silent contributors, our lifestyle. We spend a lot of time sitting, which causes our hamstrings and hip flexors to tighten and our glutes to fall asleep. When we finally do move, whether it's a weekend hike or a gym session, those sleepy muscles don't support the joint properly, putting all the pressure directly on the cartilage. On the flip side, sudden increases in activity can cause tendinitis. If you went from 0 to 5 miles of walking a day, your tendons are likely screaming because they haven't had time to adapt to the load. We also have to consider the wear and tear. Inside your knee, you have the meniscus, a C-shaped cushion of cartilage, and the protective coating on the bones. Over time, or due to old injuries, this can thin out, leading to osteoarthritis. Sounds scary, but it's often a natural part of aging, much like getting gray hair. The pain usually comes when the joint becomes inflamed or the surrounding muscles can't stabilize the area anymore. So what do? Most knee pain isn't a life sentence. It's a signal. It's your body asking for more strength in the glutes and quads, better mobility in the hips, or perhaps just a bit more rest and a more gradual approach to exercise. While rest is important for sharp, acute pain, movement is usually the medicine for chronic aches. Strengthening the supporting cast of muscles is the best way to take the pressure off the star of the show, your knee. If the pain is keeping you up at night or if the joint feels unstable, it's always worth seeing a professional. But for many of us, the answer to why do my knees hurt is simply that our knees are asking for a little more support from the rest of the body.